to us today about the epidemiologic aspect of alcohol-related liver disease during the pandemic. And Robert, thank you very much for speaking again.
Great. Thanks, Will. Thanks so much for the kind introduction. And thanks, everyone, for sticking it out for our final session. And this is actually a very timely segue into our cocktail clinical exchange. So keep these data in mind as you drink your second and third drink later this evening. So objectives today, I'm going to review some of the recent trends in epidemiology of alcohol-associated liver disease in the US. And really try to help us understand how, I'll just refer to this as ALD, epidemiology and outcomes have been affected by the onset of COVID-19 pandemic. And then finally, I'm going to touch a little bit on some of the unmet needs in addressing ALD during the pandemic. And as we've been saying post-pandemic for a long time, but maybe let's call it the COVID endemic period as we progress into the next few months and years. So first, I'm going to start and illustrate some data that highlights that ALD-related morbidity and mortality was a problem, as Will mentioned, even before the pandemic. There have been many existing studies that demonstrate the rising prevalence of ALD in the US. And similarly concerning not just ALD alone, but ALD advanced liver disease. And what I mean by that are patients with ALCAP, severe ALCAP, cirrhosis, end-stage liver disease, and even ALD-related HCC. And this has led to a major impact on patient morbidity and mortality, and also a huge impact on healthcare resource utilization in our health systems across the country. Now, this pandemic has really fueled the continued rise in ALD, and especially ALD-related morbidity and mortality. And I'm going to talk a little bit about that in sort of the second part of the next few slides. Oops. So first, I want to talk a little bit about pre-pandemic. This was one nice study we did a couple of years ago that used 3 large databases to try and really understand and define the epidemiology of ALD in the US. We used the NHANES, some of you may be familiar with, the National Health and Nutrition Examination Survey. It's a really population-based survey of adults randomly done every 2 years. It's not specific for liver disease, but it assesses a variety of questions. A subset is brought in for lab testing, anthropometric testing. So it's a really nice tool to evaluate clinical questions if you have the appropriate data to answer. And then second, we looked at the NIS, the Nationwide Inpatient Sample, which is a HCUP database that looks at hospitalizations in the US. And then finally, I'll touch a little bit on the UNOS, which many of you here know is the liver transplant registry or waitlist data in the US. So what did we show? The first graph here illustrates some of the trends that we saw in NHANES. So the bar graphs represents just total alcoholic liver disease. And at least in the time period that we examined, and remember this is pre-pandemic, looking at the error bars and the overall graphs, our ALD prevalence itself didn't really seem to change too much. But the line bar graph there represents patients with ALD and advanced fibrosis as measured using we talked about non-invasive testing earlier today, but lab-based non-invasive tests. And you see that there seems to be a trend toward more advanced liver disease. So ALD itself hasn't really changed, but definitely those with ALD are getting sicker, more advanced. And by extrapolation, those patients will develop cirrhosis, HCC, and need for liver transplant. So then we said, okay, fine, we saw that. Let's look at hospitalizations to see if that trend continues. Well, definitely we saw a very interesting trend. Just to orient you, the bar graphs represents patients hospitalized for alcoholic cirrhosis. And from 2007 all the way across to 2014. So, a little bit dated, but these data are constantly being updated. We saw a general trend towards greater number of cirrhosis hospitalizations. What about the lines? What do those mean? The top line represents ALK cirrhosis patients with one decompensation event. So decompensation, ascites, variceal bleeding, hepatic encephalopathy, hepatorenal. The second line represents those with two complications, and then the third represents those with ALK cirrhosis and three or more complications. So we saw that total ALK cirrhosis hospitalizations increase, but even more concerning and sort of aligned with the same concept that we saw in NHANES, those with more advanced disease was also decreasing. So the solid line showing that those with three or more complications also increasing over the study period that we saw. To validate this, also, we looked at the UNOS database. And again, same trend that we saw. The total, the solid line represents total ALD patients listed for liver transplants. And then the bar graphs represents those with ALD-related HCC. So the narrative and story that we're showing is early stage, late stage, and very end stage, we continue to see over time sicker and sicker patients with alcoholic liver disease. And that's really a concerning trend. We also looked at ALK HEP and ALK cirrhosis hospitalizations. And what this really shows on the left side is alcoholic cirrhosis hospitalizations, again, using the NIS data set, proportional increase over time. So using 2007 as baseline, over time, we saw very significant increases in alcoholic cirrhosis hospitalizations. When we look at alcoholic hepatitis, same thing. You can see here on the graph here, in terms of total hospitalizations, there was almost 30% increase in 2014 compared to 2007, higher increase in men compared to women. What about transplants? A little bit hard for you to see here, but we looked at the UNOS database, as I mentioned, as an indication for liver transplant. We carried this out to 2019, which is the most recent one at the time of this publication. And I'll just draw your line. There's a lot of different graphs here, but I'll draw your line to the one for alcoholic liver disease, which is I'm not sure how to describe that color, like a light blue, I guess, color here. And you can see over time, alcoholic liver disease has become the #1 indication for liver transplant waitlist registration. And when we stratified by non-HCC, clearly is the leading indication, but not so much for HCC. The other really nice thing that we see here is the decline in the red line, which represents Hep C related indication. This is a really nice paper that also shows alcoholic liver disease contributing to high rates of cirrhosis related mortality. This was a paper published by Elliott Tapper a few years ago now, 2018, that used the CDS mortality database and looked at cirrhosis related mortality over time. From 2009 to 2016, they saw an annual increase of 3.4% for cirrhosis mortality. And when they broke it down by different etiologies, age, and different stratifications, as you can see here in the graph, which shows the change in mortality from 2009 to 2016, the greatest increase was actually seen in young individuals, age 25 to 34, young individuals with alcohol-related liver disease or alcohol use disorder. So very concerning. It really highlights the concern about alcohol use in young individuals. Now moving into the pandemic, this was a recent paper published in Annals looking at alcohol sales. So using the Nielsen National Consumer Panel, the study looked at retail purchases over time of alcohol, which includes a variety of alcoholic beverages. And as you can see here from 2017, 18, 19, and then during the pandemic, there was a bump, a 34% increase in alcohol sales and average about $9.6 billion of alcohol sales. So those of you that know me, I'm not really a big drinker myself. I would maybe drink one day a month or maybe 2 days a month. But during the pandemic, for some reason, our cabinets were overflowing with alcohol. So this is an overflow cabinet. And for some reason, we ended up with a bar carts, and all these boxes in the background are actually full of wine and beer for some reason. And so, I asked myself, why is that? And then I started looking through, my emails and started noticing these social media trends as I'm looking for DoorDash and Uber. And it's too much to digest today, but social media, especially for young adults, I think is an important avenue for marketing and advertising. And every time I open up DoorDash and Uber Eats or whatever, I see all these sales for alcohol, and it's maybe it's my purchase pattern, but either way, it's no wonder that there's so much marketing and an increase in alcohol. And we can talk so much about that, but I would just leave that for a different day. Increasing alcohol consumption. So we talked about sales. What about actual consumption? So this was another survey data for self-reported alcohol. They did 30 days in 2019, and then they did another 30-day sample right after the start of the pandemic and around May to June of 2020. And this graph shows the increase in self-reported alcohol consumption, overall 14% increase. And interestingly, there are some groups that had even more increase. You see in women, there was more increase, about 16, 17%. And again, look at the young adults, aged 30 to 59, was a huge increase in self-reported alcohol consumption. And then we also saw, this is something the study did not look into too much detail, but interestingly, ethnic minorities, oops, I got kind of cut off there, but particularly non-Hispanic Blacks and Hispanics had the most reported increase in alcohol consumption at the start of the pandemic. Why is that important? This increase is likely to exacerbate ALD burden. Alcohol abstinence is particularly important in patients with chronic liver disease and definitely those with advanced liver disease. We know that the pandemic-driven increases in alcohol will further increase incidence of ALD and trigger decompensation. There are many studies that have already showed increasing hospitalizations for ALK-HEP and ACLF related to ALD. And increasing number of patients with ALD that I showed you that are requiring liver transplants evaluation, either for ALK cirrhosis, ACLF, or even for alcoholic hepatitis. This is just one quick study in the epicenter in New York, a single center study that looked at the immediate post period of the pandemic, and they saw a huge increase, 62% increase in hospital transfers for ALD, primarily for ACLF, from the pre-COVID to the immediate COVID era. And they saw definitely their inpatient census, as many of us here also have experienced, a huge increase of ALD on the inpatient census during the COVID. And unfortunately, some of that has continued to persist. This is another study published in one of the JAMA papers, looked at pandemic-related increase in ALK-HEP transplants. And so I'm just going to circle the pandemic periods here. And what this showed is increases in ALK-HEP-related transplants directly correlated with the last graph here, alcohol sales. So that makes sense. And we saw increased sales, we saw increased consumption, we're seeing increased rates of ALK-HEP, ALK cirrhosis, decompensation, ACLF, and finally, we're seeing direct correlated increase in ALK-HEP-related transplant evaluations. And then finally, in the era of COVID, sure, alcohol is contributing to exacerbation, but how does alcohol itself also relate to COVID outcomes? So this is a different way of looking at it. It was a very nice study published in Journal of Hepatology, a multinational study with 2 international COVID-19 registries looking at patients with chronic liver disease and COVID. Oh, sorry, let me flip it around the other way. COVID with or without liver disease. So they had patients with COVID plus CLD versus people with COVID-19 without chronic liver disease. Of course, overall mortality was higher in patients with underlying cirrhosis, as you can see, 32 versus 8%. And you can see across the figure here where they stratified patients. First bar in each set represents CLD without cirrhosis, and then child's ABC. And you see here whether it's ICU admission, renal replacement therapy, need for ventilation, or death. As you have more advanced disease, of course, you have a higher risk of these events. But I want to highlight what they showed or found in their multivariate model was that patients with underlying ALD had significantly higher overall mortality related to COVID than those patients without ALD. And coming back to the narrative that increasing alcohol not only leads to worse liver disease outcomes, but in the era of COVID actually translated into worse COVID-related outcomes as well. Effective alcohol consumption. There was one study that looked at how alcohol consumption during the pandemic leads to long-term outcomes. This was a modeling study that looked at what 1 year increase in alcohol consumption during the pandemic is estimated to result in. They saw that it would lead to 8,000 additional ALD-related deaths, 19,000 related cases of decompensated cirrhosis, 1,000 extra cases of HCC, and 8.9 disability-adjusted life years between 2020 and 2040. So huge impact on clinical outcomes, healthcare resource utilization, and I would say a big potential burden on our healthcare systems. Sustained, and this was 1 year, but a sustained increase in consumption beyond a year could lead to even worse morbidity and mortality. So there's really a need for a more innovative multidisciplinary approach to this rising trend. And there's been a lot of interest across the societies, funding agencies like NIH and health policy to address this, particularly among young adults. And while the pandemic has disrupted traditional care delivery, I think it's interesting to think about how the adoption of telehealth during the pandemic may create opportunities for us to better deliver care for patients with alcohol use disorder and ALD, and also how we can engage multidisciplinary teams to optimize complex management of alcohol use disorder and ALD. And then thinking about what opportunities exist for us to develop necessary skills to address this pandemic of ALD and alcohol use disorder in our patients. I'm not going to read this for you, but this is just, the slides are available for you to see. There's several addiction medicine training opportunities for us in clinical practice if we want to gain more skills and comfort with treating addiction, especially alcohol use disorder in our patients. This is something I had the opportunity to participate in. It was, during the pandemic, there's not much, face-to-face conferences. So this was a nice webinar that I had the opportunity to do, whereas multidisciplinary hepatologists, psychiatrists, psychologists, and addiction specialists that gave some didactics on how to approach alcohol use disorder, how to think about motivational interviewing, and also therapeutics for treating alcohol addiction. And this was sort of one of the sessions that we had. It was a really amazing session, and I learned a lot from this program. So in the last 2 minutes here, as the timer is ticking away like a bomb, take home points. The burden of ALD in the US has been rising even before the onset of the pandemic. And hopefully I was able to show you that pandemic-driven increases in alcohol consumption, particularly among young adults, will have dire consequences in fueling ALD-related morbidity and mortality in the near term. And the long-term impact of these trends on ALD epidemiology and outcomes are unclear, but these studies and prediction models like the one I showed, I think paint a very, very concerning view and highlight a dire need to do something very urgently to address these trends. Innovative interventions that incorporate multidisciplinary teams and capitalize on the advent of telehealth, which is sort of one of the few bright spots that I think we take away from the pandemic, may improve access to care and delivery of addiction medicine services for these patients. Future directions, I'm not going to read this, but again, this is a reference slide for those of you that are interested. There remain significant gaps in our understanding of the impact of alcohol during the pandemic, and also the long-term impact of ALD outcomes, I think require further research. And this is a nice table from one of the ASLD journals recently that highlights some of the research priorities and unmet needs in the field of alcoholic liver disease that we need more investment in research and funding and industry and all of these things to really address this very, very important problem. And with that, I want to thank NCSCG and the organizing committee for giving me the opportunity to present. Thank you.
Sorry, I'm gonna have to keep an eye on the Zoom chat as well, but I think we're good. I was just fascinated by what the anecdote you told about the social media, but when you're thinking about, and this may be difficult to think about, but your last slide talked about a need to understand factors associated with behavioral changes in alcohol-related liver disease during the pandemic. I mean, has anyone looked at social media? It's incredibly prevalent. It's powerful, and you made a joke about it, but I think everyone, I mean, I've seen the same ads on my feeds. So I don't know if you came across anything or.
Yeah, I mean, there have been some studies. I mean, the tricky thing about these studies are it's hard to do quantitative type of studies, and a lot of it's qualitative type, and trying to understand how the impact of these types of targeted, very targeted in some situations, how they affect behavioral patterns and alcohol purchases. And there are data. I mean, we know that the internet tracks us, and we know that it influences our behavior and across a variety of things, whether it's shopping, food purchases, etc. So I think it's very concerning to see these types of very targeted messaging. And alcohol is dangerous, but it's not as regulated as other things that are, some may argue, less or more dangerous. But I think there needs to be more attention focused on that, and a reassessment of whether it's safe to allow this type of direct marketing to certain subsets of the population. Oh, okay.
Now we'll make this the last question. Does the AASLD or American Liver Foundation have any policy activity around the more liberalized liquor laws to go, or the app delivery that you're aware of?
As some of you know, the AASLD is a very strict evidence-based conservative organization, and really relies on high quality data. So I think that until there is really high quality data to show negative impacts, it's hard to make broad policy shaping views. But the AASLD and all of these societies are very clear, though, that in patients with underlying liver disease, particularly those with advanced liver disease, that alcohol abstinence is key to preventing disease progression. I think that's uniformly agreed upon.
Thank you.
Yeah, thanks.
All right, well, thank you.